as a vaccine gets closer to approval and distribution, there are many questions about the process and what it means once you get the shot.
And there are concerns, of course, about the growing caseload as well. Here to discuss it with us is Dr. Daniel Koritzkis, Chief of the Division of Infectious Diseases at Brigham and Women's Hospital. Dr. Koritzkis, thank you so much for joining us.
Good morning, Jennifer. Good morning, Rondella. It's a pleasure to be with you.
Good morning. Well, first, we do want to ask you about hospital capacity right now, if we can. Other states are warning there could be a shortage of beds. In Massachusetts, how are we doing in terms of beds and staffing?
We're holding our own at the present time. Fortunately, because of the age structure of who's getting infected in Massachusetts now, we're seeing many fewer people admitted to the intensive care unit. That doesn't mean we don't have to be concerned about what the future might hold, particularly after the Christmas holidays. But for now, we're doing okay.
Pfizer's vaccine could be approved for emergency use later this week. What can people expect to see in terms of the distribution of the vaccine in the weeks to come after that?
Well, the governor is supposed to come out with a plan for distribution in the state in the next few days. I think we're going to see a distribution plan that closely mirrors that recommended by the CDC, with healthcare workers and residents of long-term care facilities being given priority.
If there are several vaccines available in the month ahead, which one should people choose? Will they have a choice?
It's not clear whether people will have a choice, at least in the initial weeks and months, because it's going to depend very much on how vaccine is being distributed from the government to the states, and then from the states to healthcare providers.
Okay, the numbers are grim. More than 230,000 people in Massachusetts have been diagnosed with COVID since the start of the pandemic. Do they need to get a vaccine, or are they immunized in some way already?
We know that people who have been infected with COVID-19 do have immunity for some period of time. We don't know how long that lasts. So we think that people should get vaccinated, but not in the first 3 months after having had COVID. They should wait at least that period of time before getting vaccinated.
A question so many people have, too, is once a person is vaccinated, when can they stop wearing a mask? When can they safely gather indoors, hug their loved ones? When should people expect to be able to do that?
Not for some period of time. We really need to see the majority of people vaccinated to know that there's no more risk of acquiring or spreading COVID-19. The vaccine will protect you from getting ill from COVID. We can't be certain it protects you against being infected, which could turn you into an asymptomatic spreader. So for probably until June or into the summer months, I think we're still going to be wearing masks and practicing social and physical distancing.
Okay, still kind of a long road ahead. Dr. Daniel Koritzkis of Brigham and Women's Hospital, thank you so much.
Thank you for your
You're very welcome.
expertise.